Hello, everyone. I'm Alex Renneman from Unleashed Tiger, and I'm here with Whitney Nevins, a nursing instructor at Penn State, who also, by the way, is a Grafton native and a WVU grad. You may know her or have known her years ago as Whitney Whitescarver. Whitney, thanks for coming on the program.
Oh, my pleasure.
Hey, so obviously the focus here is COVID-19 and what's going on. We've interviewed several folks. I really wanted to bring you on because, well, for lots of reasons, and we'll get into that. But you have, I think, a unique perspective that we've not really heard from much, I think, at least in our area. And I'd like to ask you, just from your perspective, well, first, just tell us a little bit about what you do. Nursing instructor, what does that mean? What's your role in healthcare?
Okay, so I have been an RN, registered nurse, since 2001, so about 19 years now. But for the last 8 years, I have been teaching the Nurses of Tomorrow. So I teach a whole bunch of different courses for Penn State nursing program for their College of Nursing.
Perfect. So from your perspective, why don't you give us a lowdown on this COVID-19 and what's going on, and just let's hear from you in your words.
Okay. So because I've been a little bit of a keyboard warrior now that I'm home, teaching from home, I have seen a lot of misinformation, just even on what the COVID-19 virus is itself. I hear a lot of coronaviruses has been around forever. This isn't new. And you're right, coronaviruses have been around for a long time. They mostly exist in animals. And like I said earlier, they are kind of like saying, like I would say, the Whitescarvers have been around for a long time, because we've been around. But like COVID-19 is one type of that. And it's actually sort of a sibling to SARS. So it would be like SARS would be my brother. And then there's never been another until now. There hasn't been another COVID-19 or SARS coronavirus 2 until now. So just so you know, it is novel, it is new, but it can get confusing when you see it referred to as those names.
Yeah, it does. And, we've talked on this program, and I think it's worth revisiting a little bit. I mean, it also gets compared quite a bit to the seasonal flu. And can you just dig in a little bit, again, from your perspective, how is it different?
Yeah. So as an educator, one of the first things I kind of really helped me in my practice was to learn that adults, when they're learning about new things, draw on perspective from things that they've experienced in the past. And I think when you think respiratory virus that's pretty contagious, that is all we know. Everybody who's alive, that's really all we know is the flu. That's all we've really had in our day-to-day lives. So it makes sense that people are comparing this to the flu. In comparison, COVID-19 is more contagious. It isn't just contagious by the droplets and touching things. We're looking at now, it seems to be also contagious fecal oro, like GI bugs too. So now we're seeing more routes of transmission. It seems to hang in the air longer when someone coughs or sneezes, which even when you're not sick, sometimes we'll cough or sneeze just a little bit. It's allergy season, we swallow the wrong way. So even if you're not sick, you can still be spreading it if you're carrying it. And then also it does tend to make a lot more of the people who get it sick, like really sick. So it's almost more like a viral pneumonia than it is like our regular flu.
Gotcha. And that makes sense. And the death rate again, data is still coming in, but the death rate seems to be, at least from what we can tell so far, different than the flu as well, right?
Correct. So most of the time, I can even use the swine flu pandemic. So something that we had that was relatively as contagious as this was the swine flu pandemic of 2009. And it affected about 100 million Americans because we didn't do anything to try to stop that. And the reason why is because even with 100 million people getting it, 12,000 people died. So it really wasn't that fatal. It did tend to make younger people a little sicker than it did the elderly population, which was unusual. But in the end of the day, it wasn't a giant burden on healthcare, and it didn't cost a lot of lives. Whereas with this, we have anywhere, some are saying like 1% seems to be the conservative estimate. World Health Organization has it at 3.4%, I believe now, It's variable as the information comes in because more people get sick. Some die, some don't, different populations. Not everybody has the same diet, not everybody has the same ethnicity, and all of those things can affect. So we won't really know for sure the difference until after this is all over and we can look back in hindsight. But from what we know now, it is much more likely to make you sick and put you in the hospital, more like anywhere from 10 to 25% of people who get this. So anywhere between 1 in 10 and 1 in 5 who get this end up in the hospital. And about half of those, 40 to 50%, are under 50. So while only 1% of the people who die are under 50, that doesn't mean that those people aren't getting really sick and ending up in the hospital with pneumonia. They are.
Yeah, that makes sense. And it may sound, somebody listening at home might be, or watching at home, may be hearing all these statistics. Yeah. He almost washes over them. But what does this mean to them? I mean, how serious is this? What action should they be taking, or should we be taking?
Yeah, it is serious. And I think a lot of things, I see probably too much just the impact of the case fatality rate, and people get arguing over that. But the truth is we really need to plan for both. I mean, obviously we have flattening the curve and staying home, and trying to keep from getting sick and keep from overwhelming our healthcare system because so many get sick and need them this time around. But also, make plans for when you do get sick, because it may happen. And especially when you have, the elderly that live alone, we need to be checking on them frequently. Check on them every few days if they're not sick. And if they're sick, check in daily to make sure that they haven't gotten sick enough that they need to go to the hospital, but are too sick or they've gotten sick enough to go to the hospital and are too sick to call for help. Same with even single parents who are raising small children by themselves. Please check in with single parents and make sure that they're doing okay, especially if they get sick, so that if anything happens, there aren't children left alone with really, really sick parents, or even ones that pass away.
Yeah, that's a really good point. I mean, I think we as a community in West Virginia tend to do a really good job taking care of one another. But just that perspective, the idea that somebody could be suffering right across the road or up the holler or whatever it may be, and nobody's reaching out. And so I think that's really wise. And we can do that without, we don't have to barge in the door and pat them on the back and hug them. I mean, we can stand out, we can call, we can knock on the door, whatever. Yeah, it's a great point to reach out and connect. Obviously, we've got lots of different ways to connect with folks nowadays. I think that's great advice. What are you, on the front lines right now, what are you seeing and hearing through your students and through the organization you work with there at Penn State? What's happening from your perspective?
Well, where I work, all the students are safe at home. So we ended up not bringing them back after spring break.
Yeah.
And spring break was in the beginning of March, which does it not seem forever ago at this point? As much it happens every day, it just seems like that was a lot more than just, 2.5 weeks or 3.5 weeks ago. It seems a long time ago. But so they are pretty much hunkered down in their homes at taking online courses. And a few of them work in healthcare, long-term care and such, but not in communities yet that have been impacted. I do belong to some nursing forums online, and it seems like when hospitals are hit, they're hit hard and they're hit fast with a lot of patients that come in sick.
So when I'm hearing this, we all want to, and I see lots of people posting on Facebook, thanks to healthcare workers, and absolutely, and that's great. And we should give them our gratitude and our honor. But what can we do as the average citizen? What do healthcare workers want to tell us? Do this or stop doing this. What is it that we can do to help make life a little bit easier on the front lines?
Honestly, so we have our director of health. I think she's secretary of health for our state. I watch her update every day, and one of the best things that she says is stay calm, stay home, and stay safe. And that's really first and foremost. If you want us to be able to take great care of you and keep the fatality rate down so that everyone's getting the best care possible, we can put as much effort and resources into everyone who's sick that we can. we really need you to listen to what your local and state government is saying to you and directing you to do. I just can't emphasize that that's truly the best thing you could possibly do for me and any other healthcare provider is to stay home.
Yeah, it seems easy enough, right? It seems like an easy ask. That's a chip shot for most of us. That said, I know folks, and my wife is one, let's make masks, let's do things. My kids want to do stuff. Are there things we can do? I mean, people want to do something, and we're just in our human nature. We want to be able to provide and have a productive output. Are there things they can do that are helpful? Are making them out? Is there a shortage out there? Will that be helpful? What can folks do?
That's a really good question. So I think it's wonderful. I've seen people making masks. I think that's amazing. That happened because the CDC made guidelines for just this situation that actually break a lot of their former guidelines simply because we have to find some way to mitigate risk for our healthcare workers until we can get them equipment that catches up with all of these people. And so bandanas and cloth masks were part of that. And I believe Joe Manchin asked you guys to make them. I would say in a local community, because these things are a last resort beyond any other measures, which is like reusing masks and kind of only using them in certain circumstances and all kinds of other strategies. Ask your local healthcare institutions, maybe give them a call and see if that's what they really want. And also, or if you know a healthcare worker and, just ask if that's something that they really could use, because it's really difficult to know what communities would need those right now and which ones don't.
Yeah, that's perfect. We're going to have our look. We just had Dr. Bender on. We're going to have some other folks on as well to just continue to try to get the message out to people in this area and beyond what they can do. So I think it's great advice. Hey, you were on this pretty early. I got to give you kudos for that. This is I'm not trying to necessarily. This is not told you so tour or anything like that, but you were out there in front of this thing saying this is real, guys. So what is it now? As people are kind of catching them, going, okay, this seems real, and we're all kind of on board for the most part. What are you seeing now that maybe others aren't, that we probably want to maybe give it a little extra attention?
What I'm seeing now is what I've been saying for a month would happen. So there really isn't anything new that I am seeing happening. Everything that's going on right now is exactly kind of what we would predict with a typical virus that would have the ability to transmit to 2 or 3 people from every one person that gets sick, which means we're doubling about every 2 to 3 days. I think we're up to every 2 days in the United States now. Because we're a bigger country and spread out more, we're going to have that happen. Whereas other countries that are smaller might have every 3 days, just simply because there's less communities spreading out. It's some of the exponential growth stuff, as I know, a little bit much for everyone. But just know that I think it's really easy when you don't see it around you. Human brains are adapted to respond to immediate threats. And by the time you're really seeing a lot of people get sick around you, it's kind of too late to do the things that you need to do to keep that from being overwhelming in your community. So it's a really strange concept to do something that really is pretty restrictive. I know you said staying home is a chip shot, but for a lot of people, working from home and you have kids at home now is hard.
Yeah, sure.
Trying to teach your kids from home, that's hard too. You have people that are trying to be parents and still have their job and then be teachers too, and it's just a lot. And so to do all of that when you don't know anybody in your town that's sick, and you only have 20 people or 50 people in your whole state that are sick, it seems like overkill, but it's not. I promise you it's not. If it hasn't started to grow a lot in your state yet, it's going to. 2 Mondays ago, so about 10 or 11 days ago in Pennsylvania, we had 76 cases and no deaths. And today we have over 1,600 cases and 16 deaths. So that's how fast it can grow. And you go from not knowing anybody and it seeming really far away it's suddenly really close and surrounds you. And by that time, your chance to really do something great to stop the spread or slow the spread is kind of past.
Yeah, that's really wise. I mean, I think the actions have to happen now. Certainly, I say that now for West Virginia. We're in that spot where we've got more cases in there because testing was slow to come around here. But it's certainly it's coming. But I think in most folks, I mean, I don't think we have one in Taylor County yet as of recording right now. A few hours later, who knows? I mean, any confirmed? Let me put it that way.
Right.
I'm sure it's here. But are there any confirmed cases? I don't know yet. But to that point, this is kind of scary. And you mentioned people staying at home and having their kids in there and everything. But if I can get a little personal for a minute, I mean, you're a mother. You're now working from home, and you obviously understand a lot of the science and the medicine behind this. But what are you doing? What are things that you can offer as a tip for folks that might be in your spot or in a similar situation where now their kids are home, they're trying to work, their kids are maybe they're scared, maybe they aren't, maybe they're asking questions. What tips can you offer, folks?
I think the biggest thing is just having patience with yourself and having patience with your kids. This is a huge transition for everybody. It's really it's traumatic for everybody. And so this isn't the time to be hard on ourselves. It's not the time to be hard on our kids. We know how to express our feelings, not that everybody necessarily does freely, but we know how. Kids often express their feelings through acting out in certain behaviors. And so just know that they don't have the adult abilities to cope with all of this in the same way that we do. It's certainly not a hopeless situation. We're certainly not doomed. It's just a situation that requires action. And so we can explain that to our kids, that it doesn't mean that, we're all in huge trouble. Especially if anyone has teenagers like me, all the stuff that they see from their friends, it's just, there's a lot of misinformation that's really scary going around there. And so I would encourage you to be informed, to share age-appropriate information about what you're doing. Frame it as we're doing really good things for all the people in our community by staying home and making sure that we're okay. We're doing really good things for their grandparents by staying home and staying safe and not being out there. And it's a hardship for everyone. It's a hardship for kids. It's a hardship for adults. But we can get through this. It isn't hopeless. And even if it is scary, if we just kind of stay calm, follow the recommendations and the guidance, stay alert to what those are, I think we'll get through with hopefully better results than if we just sort of let this rip through.
Yeah, so you used the word hope, at least the root word hope, and hopefully, what can we look? I always try in any situation, man. I try to find the gratitude. I try to find the silver lining. What can we take from this after this experience is over? And obviously, nobody knows what's going to happen, but unfortunately, there's going to be there already has been deaths. There are going to continue to be deaths. People will be sick. There'll be lives disrupted. The economy. There's all kinds of things. But we can ask, what can we look to and go? But we now know this. We've done this. This thing will happen. What things are you looking at and saying, at least these are silver linings?
Yeah. So in responding to that, I just want to have the disclaimer. I'm not making light of this. It is a difficult situation. Probably many of us will have someone close to us who gets really, really sick or dies from this, and that's going to be hard. There's going to be a lot of grief. There's a lot of worries about the economy and whether we're going to be able to pay our bills. Thankfully, it looks like we're getting some relief from unemployment and even the federal government with that, and that's wonderful. But I think also there is sort of a gift in losing some things, that it kind of makes you realize two things: what you had before, and you become more grateful for that. It also makes you realize what you still have, even after all of those things aren't there. And the other thing I think that might come through is, and my hope, is that we learn that we really do need to be connected, and not just electronically, but in just our humanity, in helping each other, and compassion towards each other. And I see a lot of that. I see a lot of the helpers and the healers emerging. And even in the midst of the TP hoarding and the panic, I'm still seeing a lot of people, like the people making masks, the people that reach out. I've had people, because they know I'm a healthcare worker, saying, how can we help? And I see a lot of that. So I think we might learn how important it is, again, that we're uplifting each other.
Yeah, I think that's great. I am always, I never just pass by where somebody's being a helper. I like to take a moment and just be grateful for that, because it is neat to see that rise up. And if you don't have a challenge, you never have those opportunities. And I know that's a weird juxtaposition, but it is the world we're in. Whitney Nevins, Grafton native and mountaineer, now a nursing instructor at Penn State. Thank you for coming on and sharing your perspective on this. I mean, this hopefully your perspective brings value to somebody else. If you're out there, you're hearing this, you've got other questions, reach out to us. Let us know. We're happy to bring anybody else back on. Is there somebody else that wants to come on? We're just trying to get the message out there of what this is and how we can take some agency and do what we need to do about it. So Whitney, thanks for coming on the program. I really appreciate it.
My pleasure.
All right. And also thank you for all of the trainings in your Army that's out there right now, taking care of all of us. And hopefully we're all doing the right thing and we're not overwhelming them, but we get this curve flattened. But yeah, thank you. I appreciate all you're doing and all of the healthcare workers, obviously. But thanks again.
Thanks.